Vaping has become extremely common over the last few years. Many who've never tried smoking tobacco have tried vaping and find themselves doing so occasionally or for some more regularly. 2,179 students from years 7 to 13 took part in the survey, which provides the first insight of its kind into young people's vaping habits in Gibraltar. Pretty much every year group had some students that had tried the tobacco replacement, but the number went up with age. And why try it? Largely out of sheer curiosity. 90% of students surveyed had never tried cigarettes, but could the growing interest in vapes lead to more tobacco smoking?
There's obviously a risk that smoking e-cigarettes might open some doors for further tobacco smoking, but we cannot really say that that's for sure. We know also that smoking e-cigarettes is less harmful than smoking, and that's often emphasized, and that's an important message when we talk about adults, because that means that for adult smoking, tobacco smoking, e-cigarettes could be a way of harm reduction to reduce the related risk.
Another curious finding was that girls are more likely to vape than boys are. Though the pattern weakens as they get older, year 10 saw almost double the number of females vaping than males.
But I understand why people would want to do it, because it's you're out, everyone's doing it, and it's kind of it's just a pressure kind of thing.
But at such a young age, I don't feel like we should.
My friends don't vape.
I've been interested in vaping, but I do know a lot of people who do, and I think it's mainly because of peer pressure reasons at this point, because it's so many people that are doing it. You'll go into the bathrooms and there's more people vaping in there than actually going to the toilet. It's nuts.
I think it's happening too much than usual, because you find 12-year-olds doing it in the streets and everything.
No, I wouldn't do it either.
Tastes nice.
I don't have a temptation to do it, if you know what I mean.
Yeah, everyone now and then and that.
But we always decline it.
Yeah, because we know that's bad for our health and it's not really good for our lungs, and especially for people that do sports like me.
I personally disagree with it. My family's been affected by smoking and stuff like that before, so I disagree with it personally.
Nah, I'd never want to try it because it's bad for our health, and I do sports, so it's bad for me.
I'd say most people my age feel the same as me, but maybe some people like it. But I say that it's really bad for you and you should not do it ever.
The types of vapes young people are using are largely those that are flavoured and have nicotine in them, though they're thought to be 95% less harmful than smoking. According to the Director of Public Health, the growing trend in using them has encouraged this approach.
And that's why we're taking a precautionary approach at the moment in terms of the careful messaging around vaping, because smoking is one of the biggest risk factors for shortening your life and increasing your chances of disease. And this is why we've been working with the Gibraltar Health Authority to improve the smoking cessation support service there, improving the access to that and the ability to refer people in so that they can quit smoking.
And how does Gibraltar compare to other places when it comes to the youth vaping? The study finds that Gibraltarian students have a higher rate of e-cigarette experimentation compared to those in Great Britain. On lifetime use, local students had a lower rate of use. However, the data used here is pre-COVID. UK's Action on Smoking and Health reports that the number of children trying vaping has gone up since COVID. It's certainly new to all of us, and its effects are new too. The research team says more work needs to be done to move towards a comprehensive understanding.
There is an important website in UK that is called Frank. It's kind of anti-drug website created by the government, in which basically we know that